Shah with the Longevity Center at St. Vincent here to tell us more about halitosis.
That's right.
Sorry, Chris, I had to do that. And we got, what are these? Icebreakers. Sugar-free mints. How about that? Cool mint. They taste pretty good, don't they?
Yeah, you brought them just in case.
Just in case. No, I'm just kidding. I found them on the counter. I don't know whose they are. But in all seriousness, I mean, we talk about people who have bad breath, but it could actually be a sign that somebody has an illness.
To answer your question, yes, it can. There are certain serious illnesses like diabetes and that you can have bad breath. A fruity smell in diabetic ketoacidosis, it can be a sign that there's underlying illness like diabetes, which is uncontrolled. A fishy smell like ammonia can be an indicator of underlying kidney failure. But more commonly, what causes bad breath or malodor of the mouth or halitosis. Basically, it is bacterial degradation of amino acids, which are found in proteins and glycoproteins, in food debris, in epithelial cells that are desquamating, which is basically lining up the mouth, which is shedding and being accumulated, and post-nasal drainage, blood, stagnant saliva. So what these do is they release volatile sulfide compounds, which are gases which are emitted, and that's what causes the bad odor in the mouth. And for those, it's an embarrassing and an awkward condition for many individuals who suffer from it. And there are more people who are more halitosis phobic than they need to be, because everybody's worried about, do I have bad breath?
Yes. Trying to smell your own breath. I don't know if that's possible.
There's only 15 to 30% of individuals who actually suffer from halitosis.
This is an actual condition.
This is an actual condition, and actually, if you're worried about it, you go to the doctor. The doctor actually does diagnostic testing, and basically, the doctor's biggest diagnostic tool is the nose, unfortunately for the doctor. But you have to give a proper history, and because you want to rule out underlying medical problems and conditions that can exist within the mouth that could lead to bad breath, and that needs to be ruled out. And then what needs to be done so it is a
but it could also be something again, bad breath could be from some common illnesses too, that we get in just going around all the time.
Absolutely. Flu season, when everybody's getting a cold and infections, sinus infections, throat infections, tonsils. But you do not need to get your tonsils taken out just because you have bad breath. That's not an indication to get a tonsillectomy. But tonsils, having recurrent tonsillitis, throat infections. Again, I talked about post-nasal drainage. So the drainage from the sinuses that drips to the back of your nose onto the back of the tongue and the back of the mouth, and that mucus sort of stays there. It can give rise to bad breath. So one needs to make sure that they get this problem addressed or the infection treated. And we'll talk about it in a second about how to address.
Well, it doesn't have to necessarily be a bad disease or sickness that causes bad breath. It could be something simple too.
Yes.
Like coffee. I was reading one of them's coffee, and I drink coffee every morning, and I feel sorry for Chris. I feel sorry for Allison and whoever else I'm working with, but I drink coffee. I drink lots of coffee, and I can't do without it.
Yeah, but it's not necessarily that it's how the bacteria in your mouth act on the proteins that are, or the food particles that are ingested, and the breakdown and the release of the gases. So some individuals have it more, some have it less. But common foods that can cause it: cabbage, onions, garlic. And garlic actually releases a gas which lingers longer. It has been, so there's prolonged exhalation of that volatile sulfide compound released from garlic. And actually people even burp up garlicky smells.
But it's so
alcohol,
good.
alcohol, coffee, even some vitamins that you take, ingest may have, will cause bad breath. So you can smell your vitamins and see if they kind of are smelly or leave a smell in your in the mouth, then those are not the vitamins to take.
We don't have much time left, but what do you do? I mean, I guess it's just proper oral hygiene, right?
Exactly. 3 things: proper brushing, flossing, and mouthwash. These all 3 are important in eliminating bad breath. Once you have ruled out that there's no serious illness that's predisposing you to this, then proper brushing and brushing in between the teeth is important, because bacteria tends to accumulate in between the teeth, and brushing on the back side of the teeth. Brushing the posterior part of the tongue, which is the back part of the tongue, about 10 centimeters back from the tip of the tongue. There are tongue cleaners, plastic tongue cleaners, not tongue twisters, that you can you need, and then mouthwash.
Right.
And mouthwash with deep rinsing and gargling is very important. But and mouthwash at night is very important, because it lasts longer and you wake up with less bad breath. But certain toothpaste can inactivate the active compound in mouthwash. So give an hour between mouthwash
between the two.
Yes.
Okay. And I guess these just are temporary relief.
That's right.
Thank you so much. That's Dr. Boucher Shah at the Longevity Center at St. Vincent. For more information, you can go to 1 St. Vincent Circle or call them at area code 501-552-4777. Thank you again.